Mr. Popsit here. If you want to help our channel grow, make sure to hit that subscribe button, hit the notification bell, and if you like the video, make sure to like it. We appreciate it. It helps us grow. So if you want to see more pops, you got to pop that button. Thank you. Okay, guys, this is an abscess. You can see here, it's pretty shiny, so there's a lot of pressure. That skin is stretched out right above the knee. There was a cyst most likely there. We can almost see that little dark spot in that pore right in the light with the shine. So we're gonna do some numbing and hopefully be able to get it numb, make a little cut and press out all those contents. She's gonna sleep a lot better tonight. Get her on an antibiotic, a little bit of packing, pretty straightforward, incision and drainage coming your way. All right, guys, we always talk about the acid-base shift. It's gonna be a little sting here. A little sting, we're gonna go all the way around, try to do a little block here. See it change in color. That's normal. Epinephrine has some vasoconstrictive properties, so those little vessels that are flushing red, it helps constrict those. Yeah, I can see that pore right there. So it's definitely a little cyst. Go. Not too bad pain-wise, you okay? Good. That's good here. We're gonna do a little bit right at the surface here. Do you feel that or not bad? Not too bad, good. Very nice. A little bit down underneath here, at the bottom. A little bit there, you felt? Yeah, a little sting? That's a burn, but that should be nice and numb for you, okay? Here we go. We're just gonna do a little poke right into that pocket, right across. Ooh, you can see that fluid coming out already. There we go. Oh, wow. Yeah, lots of cyst. This is cyst contents right there, so it's definitely an inflamed cyst. That's good. The pain that you're feeling is the pressure. That's good there. Getting a good bit out. There's the bottom of the cyst there. Getting some of the cyst wall. The nerves that feel pressure are really pushed against, and that's why you feel a lot of that pain. That is good. Got quite a bit out just on the first push here. Not too bad pain-wise? Let me know if it hurts at all. I got you pretty numb, it looks like. A little bit right there. Do we have one of the curettes? That's the one thing. Yeah, let me see. Yeah, the curette would be helpful. Okay. Thank you so much. And if we have some forceps too. With or without? With teeth. Just a little one with teeth. Straight down pushing. We're still getting some. Trying to make a really small cut there. I can see some cyst contents we'll try to get out for her. Okay. A little bit more pushing here. Thank you. This is just blunt here. We're gonna kind of scoop in and around. If she has any pain, she's gonna let me know. I can see cyst contents. We're breaking up here. Little areas around. Yeah, amazing, huh? You can see that cyst wall right there. These are all cyst contents here. I'm gonna see if I can get a lot of that sac out, which we might be able to. Yeah, there's part of the sac here. Nice. There we go. Very good. You can see that's the sac right here. Wow. A very thin wall. Wasn't a huge cyst, but there's a lot of huge inflammation around it, that's for sure. Put that together, that's almost the entire sac, it looks like. So, like a cracked egg, basically. Wow. Yeah. Do a little bit more squeezing down deep here. Good. you see it a little bit more right here. No pain? Good, you're doing great.
You're doing good, doctor.
Yeah, thank you. So what we're gonna do is walk back here just a little bit, kind of start separating that cyst wall. There we go, pops right out. Try to get everything I can see visually of the cyst, so hopefully it doesn't return, but it's always possible. You can dab there a little. There we go. I have better control by holding the blade. That's very good. Getting that last bit out here. Yeah, not much left. Very good.
Doctor, you're awesome.
What's that?
You're awesome.
Oh, thank you. That's good. There's a little empty pocket in there. I don't see any more cyst contents. It looks like it's a really tiny little hole. Now we don't want to close this up and put a stitch in or it'll fill right back up. You can see it's almost an indentation now because we cleared that pocket. I'm going to do a little bit of flushing just to get any other small contents that might be in there. Let me see. I see one more little strip here. Possible cyst wall right here. Yeah. See if we can get that out. She was very numb. That's good. We hope to cause minimal pain with these, and you're going to feel so much better within a day or two.
Yeah.
The antibiotic's going to help if there was any type of bacteria in there, which usually there's not. I didn't see any whiteheads, so.
So we do the whole month for antibiotics?
Yeah, we might just do 2 weeks.
Okay.
Yeah. Let me get that guy right there. It's just a thin piece of cyst wall, just attached right at the edge. Got it. That's perfect. We'll try a little Q-tip in here, just to go around. This isn't sharp. It's not metal, so it shouldn't hurt at the bottom of the pocket. Not a huge pocket, actually, which is good. Yeah, thank you. Do a little bit of flushing here. It's just going to roll out. Good. Perfect. I see a lot of contents when I do that. Sometimes we'll dig a little deeper. Didn't see any, just fluid. So that looks good. And hopefully it looks like I got most of that cyst, if not all of it. So I think you're going to be good. It shouldn't regrow. It's not really deep enough to put packing on there either. If it's really deep, I'll put a bunch of packing in, but that looks pretty decent. It's just right at the surface there. So a little pressure bandage right there. It'll kind of close up that pocket. It'll leak for three or 4 days. We're going to recheck you in 1 week just to see, make sure that everything went down. If I put a stitch in there, it'll fill right back up like a water balloon. So the antibiotic's going to help you from secreting, bring down inflammation, and it'll close up for you with a little tiny scar.
If the blood come out, what should I do?
Well, you keep what we're putting on for 48 hours. You'll keep that on there, and then that will stop any bleeding. So it'll be soaking up for that. After that, if it's bleeding, you just hold pressure 15 minutes like that, and it'll stop. But there's no real big bleeders there or anything like that. Let me just see. Sorry, guys. One more. I'm a perfectionist.
Me too.
Yeah. Yeah, that's good. There was just a tiny bit right by that other one. Got it. Looks great. She's going to put that pressure bandage on there. Thanks again to my patient for sharing. That was a textbook IND right above the knee. We just had another one right above the knee. They come in pairs like that sometimes. But thanks for watching, guys, and thanks for popping by. She's going to feel a lot better and sleep a lot better tonight. Okay guys, this was the large knee abscess. You can see here this breakdown of the blood here. It kind of turns yellowish as we're breaking down. Bruises start to fade. The little hole that we cut is closed up and coming together nicely. She does walk quite a bit, so she's got a little bit of bruising, possibly a little bit of blood that was inside. That's going to dry up and reabsorb as well. So we're just 7 days out, but her pain is way less. It's not warm at all. Still a little bit of induration. That's most likely from the walking. But looks great, and looks like we got everything out of there, so this should resolve completely. We'll do another follow-up in 2 weeks, and we just kind of follow that and make sure that it's going away and there's no more cysts that's starting to regrow. And if there is, we do an excision a couple months from now. But looking good, and we'll keep an eye on it for her. Thanks for popping by.